Hi, this is Sheena Chris, and I will be your student nurse for today. And we are going to administer enteral feeding via nasogastric tube. And first, we are going to check the positions order for the type, amount, and time of feeding. This is to make sure that the type, amount, and time of the feeding are correct, and this is to avoid errors. Alright. Now, we need to wash our hands to clean and remove microorganisms and to prevent contaminations. So we assume that we'll wash our hands. Then we need to assemble the equipments we needed. First, the prescribed solutions, the 50 ml bulb or asepto syringe, glass with calibration, 30 to 50 ml of water, next is small towel, stethoscope, gloves, and NGT tube. This is to be prepared for the procedures, and this is also to make sure that the equipments are functioning properly before using it to the clients. Then, identify the client. Hi sir, I am Sheena and I will be your student nurse for today. May I know your name please? Alright, can I check your wrist for the tag? Okay. By the way, sir, I am going to administer enteral feeding by a nasogastric tube. In this procedure, I will going to insert a tube through your nose, going through your stomach, and this will be a passage of your food because currently you cannot take anything by mouth. Is that okay, sir? Alright, you can feel a little bit discomfort, but I need you to cooperate with me. Is that okay? Alright. Now we're going to inspect and palpate patient's abdomen for distensions. I will check your abdomen for a while, sir. Excuse me. Alright. Now we're going to position the client in high Fowler positions. So, excuse me sir, I'm going to position you in high Fowler. Just hold on a second. Alright. And just wait me for a bit because I'm going to get the equipment needed and we're going to start the procedure. Is that okay? Alright, thank you. Now spread the small towel and put it in the chest of the client. Get some gloves. Now, check the placement of the nasogastric tube using two techniques. Now we're going to assume that we already inserted the NG tube to the client's nose through the stomach. So measure it. we're going to check the placement of the NGT tube using two techniques. First is aspiration of gastric contents to stomach through syringe using gravity. Second is auscultation. We're going to inject 2 to 30 millimeters of air while listening with a stethoscope positioned to the epigastric area. This is to make sure that the NG tube is inserted correctly in the stomach. And we're doing the second technique, which is auscultation. Alright. Now we're going to initiate intermittent feeding. We're going to pinch a proximal end of the feeding tube. Remember that feeding very quickly can cause nausea and abdominal cramping to the patient. Now we need to remove the cup. Now we're going to fill the aseptic syringe with the formula. And we need to elevate the syringe for 18 inches above the head of the patient. Okay, we need to release tubing and allow formula to flow by the gravity. Alright. Now, after administering the prescribed amount of formula, flush the tubing at least 30 cc of water. Okay. 30 cc. Alright, 30 cc of water. Then release. This is to prevent the clog or obstructions in the tubing feeding for the next procedure. Alright. Now, after the feeding is complete, cover the end of the feeding tube with a plug or clamp. This is to avoid any contaminations in the stomach. Then put it on the client's clothes for the secure. Now we need to remove the aseptic syringe and cover the end of the feeding tube. Alright. And we need to put it in the client's clothes and to secure it. You need to remain the patient in high Fowler positions for 30 to 60 minutes. Because elevated positions prevent the clients from aspirations of feeding solutions into the lungs. Now we're going to rinse the equipment with warm water and dry it. This is to disinfect the equipment and avoid contaminations and transmission of any microorganisms. Now record and document the procedure. And includes the type and amount of feeding given, the time it was given, amount of additional water given, and patient's tolerance of the procedure. Okay? It is important to record patient's data and it is essential for the next feeding procedure for the client. Then monitor the breath sounds, vowel sounds, gastric distensions, diarrhea, constipations, intake and output, daily weight, and serum chemistry result. This is to determine the placement and patency of NGT. And monitor any unusualities or abnormalities on patient's nutritional health.